Good morning, welcome. And you don't need to speak too loud. Okay. Good morning. Welcome in this session, this parallel session on digital technologies, OSH management and risk prevention. This morning we have four really interesting speakers, and they have all been part of the last years in our research project and our preparation. So it's really good to see you all back again and now being involved in this last summit. And yeah, we're really interested to hear in your presentation and your story. So first, I would like to introduce Kyrillos. Kyrillos Spiridopoulos, we practice. He is a scholar and senior research manager, and he specialized in EU. Has been working on EU-OSHA's portfolio on the policy and research unit from the policy and research unit at ECORES. And he worked in our 3-year study on digital OSH monitoring system. That was how the project was called in the beginning, on the priority area of smart digital systems. And so his work has really been on the beginning of this campaign. And I would like to give you the floor and do the presentation.
Thank you, Annick, and thanks to EU-OSHA for the invitation. It's really great being here and present the work that we've been doing over the past 3 years and some. My name is Kyrillos. I work as a senior research manager at ECORES. We are a research and consulting firm headquartered in Rotterdam, but also with offices in Brussels, where I am based, the UK, and across Europe. And today I'm here to present our work on smart digital systems for better safety and health at work. As Annick suggested, this is part of EU-OSHA's flagship work on the OSH overview on digitalization that included 5 different projects. So one on advanced robotics, new forms of worker management, OSH and digital platform work, telework and remote work for occupational safety and health, and many of those are presented either in the parallel sessions or have been presented earlier. And I'm here to present this one on the smart digital systems for better safety and health. So the main research question that we had over these 3 years is to really explore the opportunities and challenges of these systems in terms of improving workers' safety and health. And how did we go about it? Is that we reviewed over 150 academic and grey literature review sources. We conducted 20 interviews with social partners, business representatives, and trade unions across Europe, as well as OSH specialists. We developed 10 case studies where we've been talking to various companies that have introduced such solutions to sort of see what is working well and what is working less well into those. And we have conducted 2 workshops to probe into and validate our findings. So, smart digital tools, what do we mean? The first thing that we had to look into was to find a working definition to begin our work. So our working definition is that those systems are using digital technology to collect and analyze data in order to identify and assess risks, prevent and or minimize harm, as well as protect occupational safety and health. And in order to explore the topic, we divided those systems into 2 categories, which of course are not clear-cut. On the one hand, we have proactive monitoring systems, and as the word suggests, they prevent occupational safety, health, and risks. And then the reactive ones, which really react to those risks. But in practice, we found that often the distinction, as I just mentioned, is not clear-cut because they can have both functions. And in terms of opportunities then, we have been looking into the case studies as well that we developed, and we found that there are numerous opportunities in these technologies. So one of the main opportunities is that they can monitor individual and workplace risks. So we found several companies that are using wearables to monitor these risks, and I'm going to show you some examples. We have found different monitoring systems in companies such as warehouses that are monitoring how workers move, and they can detect unsafe behaviors. And I believe one of the examples here in the exhibition shows how this can work. We've also seen a very important function in terms of alerting workers and providing them with on-the-job training. So we have found infrared cameras on industrial vehicles that can detect the workers that are nearby, for example, a forklift in a manufacturing plant, and then they can give an alert to the forklift operator when a worker is at their vicinity. And with Internet of Things, increasingly, it might also be possible to automatically stop this vehicle to avoid a collision. We've also found examples of on-the-job training via wearables, so in terms of, for example, hand arm vibration, or as I mentioned earlier, in terms of ergonomics. Another big opportunity that we found was the option to conduct remote risk assessments in dangerous places. So it might have been a construction site, and then we have found that companies have really replaced people and used drones instead to conduct some of these riskier operations. And finally, providing data insights that can help workplaces improve occupational safety and health. So say that you have a very big plant, and then you get the data from risk hotspots where most accidents happen, and this can lead to a reorientation of the layout of this workplace to really reduce those incidents. And here is one of the case study examples that we have found. This one is coming from Ireland. We talked to an enterprise that has developed a wearable device that can monitor hand arm vibration, and this was really important both for young workers who were inexperienced in using those tools, but also for older workers that could be more sensitive to this sort of vibration. And in each of these case studies that are all available as standalone publications, we investigated the opportunities, but also some of these challenges. For instance, in this case, some concerns around data privacy, but also compliance, because workers are not always very happy to use these systems, or they tend to forget them. Coming to the second big strand, we found we've looked into reactive OSH monitoring systems, and then one of the principal functions that we've seen is that they can help respond to emergencies. So, for instance, we have examined various systems that can detect emergencies, having man-down functions, for example, but also, and as we've seen yesterday for those who were here, they can localize emergencies and reduce the time of rescue operations. And here you can imagine, for instance, a mining setup where an accident might occur. We've also found that they can help in accident investigation and reporting, so they can help establish a good sort of audit trail of what happened, when it happened, and how did the whole incident unfold. And similar to the proactive systems, they can really provide data insights that can help workplaces improve safety and health. And this one is one of the examples that we've seen. This comes from a French company that has developed a technology for smart insoles for lone worker protection. So imagine that you are working in a remote area and you have this insoles installed to your shoes. Then in case of an accident, they can really send a signal that can help reduce the reaction time for rescue operations. And then looking at the challenges as well, we've seen that there might be, some companies might be tempted to sort of send one worker in operations where they would usually send two for safety reasons, but also some questions around reliability and trust. Going into the challenges now, here we found quite some. So there are usually practical issues, and here we have several examples. So we have issues around reliability. So what happens, say, if a battery malfunctions, about sensor accuracy, because most of the sensors are tested in sort of safe environment, but what happens in an environment where there are several environmental factors like a lot of heat, a lot of dust, would they send as accurate measurements as they would in their sort of test conditions? Hardware that restricts movements. So we've been talking to a trade union in Germany, and they were talking about how, for example, an exoskeleton sometimes can be difficult to mount and unmount, and workers are having sometimes discomfort, especially when they want to put it off to have their break. Technical limitations, but as well, and very importantly, unintended effects. So staying within the examples of exoskeletons, what is the impact of redistribution of the weight to the other parts of the body? So yes, you can lift things easier, but this weight might be redistributed to another area of the body. So what is really the net effect of that? Some other categories that we've seen is work intensification. So often these systems might come as a pretext for safety, but in practice they do focus on productivity. And the question here is, are we turning the workplaces in an electronic sweatshop? But as well as worker alienation. So there's a lot of issues there. You can see them on the left-hand side. I don't want to go through all of them. But essentially, yes, invasion of privacy, loss of ownership, and so on and so forth. And that's just an example of sometimes, we integrate all of these systems and we expect people to act normally. This is not always the case. And closing with the challenges, we've also seen a lot of issues around data. So data privacy, security, accuracy, as well as interpretation and misuse. So how are these data really being interpreted and how are they used? So in summary, we found that, yes, the smart digital systems do have a lot of opportunities, but at the same time, they can have reverse effects. They do have their limitations. They can by no means be the solution to safety and health by themselves, and often come with important issues around data. So what do we do about it? How do we harness really the opportunities to make the most out of them? The first thing that the first conclusion that we reached is that it is really essential to understand those systems, what they can do, but more importantly also what they cannot do, and really communicate their limitations. At the same time, we saw that in most of the cases, these systems worked better when the product manufacturer was working in close cooperation with the company. So tailor-made solutions were found to work better relative to those that are off the shelf. And finally, we've seen that it is really important to involve workers, and we've seen today and yesterday as well the example of the Irish distilleries, where the workers have been involved really from the beginning, from conceptualization all the way through the implementation. The second research question that we had was about the activities that product manufacturers, but also companies can do to really make the most out of this system. And here are the three main takeaways. The first is to really involve workers in selecting, testing, but also in fine-tuning the system throughout the implementation, because there's always going to be some room for fine-tuning or maybe making some small adaptation and so on and so forth. The second one was in situ or remote trainings, but also some talks and toolbox meetings. And here is one of the quite obvious, but sometimes overlooked conclusion, that it's really important that an OSH manager is in place and they have what we found and labeled as walks on the talks. They walk on the premises, somebody's on the ground, they talk to their employees on a daily basis or regularly to find out what is happening on the actual workplace, but also placing emphasis on the existing OSH procedures. So as I noted earlier, these systems are not the silver line to safety and health, and we found that companies with a strong safety culture are much more likely to effectively integrate those systems to their workplace relative to those who don't have such a culture. And last but not least, involving, as we said, the workers in every step of the process. Finally, we have identified some sort of gaps and needs, and here I'm going to focus on three areas. The first is knowledge exchange. So we found that there is scope for cross-company or even cross-sectoral dialogues, perhaps through peer learning activities on to sort of make this cross-fertilization of lessons learned, what works well on the ground, and this could be an area that could be developed. We found that there is a need for accessible information to the workers, providing them information about their rights, data, but the limitations of the systems. And this information, of course, depending on the sector, can be shared in various ways. It can be a leaflet, it can be a poster on the workplace. It can be leveraging, for example, a safety and health day and having the workers all together, discuss in small groups or in a workshop. And finally, and this comes across quite strongly, workers' consultation, really in all of the cases that we've seen, we found the most successful examples where workers really were involved from thinking about the solution all the way through the implementation. And here, one example that I can really recall was that some companies really had some ambassadors, some workers who sort of relayed the message to their peers about the system and how it works, and this really helped to get some buy-in to implement the product on the different workplaces. So, yeah. I think I won't need it, so I'm probably right on time. So this was my presentation. I'll be around for the rest of the day, and I'm happy to receive questions either once my peers finish their presentations or afterwards. So thanks very much.
Thank you, Kyrillos. I can say very interesting, but it's also interesting to see how this work has been input now until the final messages of the campaign now, so that's good work. We have time for one or two questions, only a few minutes, but if there already somebody wants to ask a question now, that's possible. Maybe online, there could be a question, but I hear that from yesterday I understood there are not so much questions asked from the outside. So if not, I would like to go on to the next speaker. So you can already go, Hilde, to your place. Her name is Dr. Hilde Varevik. She's a special advisor at the Innovation Norway, and she was a research manager at Sintef. And I would like to say a few things on her bio. That's she has a PhD in applied physiology, and over a decade of scientific experience in occupational safety and health, with a particular focus on supporting workers in extreme environments such as the military, firefighting, and the maritime sector. And still she's working on innovation, and she supports Norway in this health tech and digital health companies. So Hilde, the floor is yours.
Thank you, Annick, and thank you for inviting me again to the EU-OSHA Healthy Workplaces Summit. As you said, I have changed job, but I still work with health and life science, and that brings maybe some new perspectives into this talk. Today, I'll discuss how digital technologies may improve health and well-being of workers in some occupations in Norway, while at the same time enhancing productivity and reducing costs. I work in Innovation Norway, and that's the Norwegian government's instrument for innovation and international business development. And our mission is simple yet powerful: to create value by supporting Norwegian companies in innovation and global growth. We work across all sectors. I only work with the health and life science sector. And we have offices all around the world, also an office here in Spain, in Madrid. So we are located in 30 countries. Let me bring you back to the Norwegian policy content, and then go further on with some examples. Norway's Working Environment Act sets high standards for physical and psychosocial safety and health at work. The three-party cooperation ensures that digital tools are co-designed with unions and employers. And the EIA agreement focusing on preventing sick leave and exclusion from work. Privacy is strictly regulated. Monitoring must be necessary, proportionate, and discussed with the staff, as we heard, very important for implementing. And Norway has, of course, contributed to this EU-OSHA campaign through Astrid. I don't know, Astrid, are you're back there? And emphasizing that health must be human-centered, privacy compliant with occupational safety and health. Norway has its own Minister for Digitalization, Karianne Tung, who last year launched a new national digitalization strategy. And this strategy is also highly relevant for occupational safety and health, as it accelerates digital transformation across all sectors. So, to this task. Smart monitoring systems offer great opportunities, but must be tailored to each profession. For example, I used to work with heat stress monitoring of firefighters and stress assessment in healthcare workers later on, which requires a truly different approach. Anyway, before implementing digital monitoring, you have to ask yourselves, why are we measuring? How will we measure? Who will use the data? How will we protect the data? And will this solution truly improve health or risk adding new stress factors at the workplace? Digital innovation should empower and not burden workers. It must be evidence-based, transparent, and participatory processes are essential. So now I will mention some of the earlier projects that I had in SINTEF as a researcher there, namely healthcare workers and petroleum workers. This was a project that we ran investigating the impact of changing schedule from 8 hours to 12 hours shift in the healthcare sector. We found large individual differences, but also that nurses working 12-hour shift face increased fatigue, sleep problems, mental stress, and a higher risk of errors. These challenges affect not only their health, but also patient safety and job satisfaction. Many nurses bring work-related worries home, impacting their ability to recover. Health technology can help address this issue, and I will come back to that. With smart scheduling, wearable monitors, and data-driven planning, we can save time and resources, and most importantly, we can help nurses focusing on their main task, patient care. When digital solutions are designed with staff involvement and flexibility, they empower healthcare workers and support better outcome. Another project that I had was called the Risk of Project. And what we learned is that it focused on health challenges in municipal services, especially among nurses and kindergarten staff. We found that emotional stress and sleep problems are major contributors to sick leave and early exit from working life. By combining objective health measurements and self-reported data and involving employees, management, and safety representatives, we develop a targeted intervention for healthier workplace. In both the kindergarten and dementia care units, our research revealed a striking similarity. Employees carry the emotional weight of their work far beyond the workplace. Many describe a persistent feeling of not being able to do their job well enough, and the demands and responsibilities keeps growing while resources remain limited. This sense of not measuring up, of unfinished tasks and unresolved situation does not disappear at the end of the workday. Employees often take these concerns back home, thinking about them late into night, which disrupts their sleep and recovery, and ultimately higher rates of sick leaves and early exit from working life. So, digital technologies must address both the physical and emotional burdens and involving staff and three-party thinking in making new interventions. It's essential for a sustainable work environment and better health outcomes. So now moving into my new work, where I work with health technology companies. And we asked Menon Economics in Norway to investigate the impact of implementing health technology. And we did a benefit analysis of health technology and evaluation of how digital and technology solutions contribute to improve health outcomes, increased efficiency, and cost savings in the healthcare sectors. This considered both direct and indirect health effects, such as better patient care, reduced workload, and long-term sustainability for health services. This analysis showed that technology is essential for meeting the growing demands in healthcare, especially when we look at having more elderly people. The analysis shows that without productivity improvements in Norway, we will need up to 760,000 full-time employees in the health and care sector by 2060, with just a 2% annual productivity increase, mainly through smarter use of technology. We could meet future needs with only 320,000 employees. This dramatic difference demonstrates how even small gains in efficiency may have huge impact on workforce requirements. Investing in technology is critical for a sustainable healthcare system. We have several Norwegian companies that are developing digital solutions for the workplace. And these innovations are not only important for productivity, they also play a role in improving occupational safety and health. How? Well, by reducing workload, preventing fatigue, and supporting better work environments. Technology helps both protect staff and patients. One example is Synplan. That is a schedule. They have a system for shift planning in the healthcare sector, and they're implementing their solution now at the Mayo Clinic. That is the world's most innovative hospital, and they wanted the Norwegian solution implemented in their hospital for staff planning. Okay, but it's also implementing health technology leads to huge savings, and not only for healthcare staff through more efficient workflows, but also reduced workload. Better care for parents, fewer hospital visits, shorter stays, and improved quality of care. Then, moving on to another sector. How much time I have? Okay. 4 or 5 minutes, okay. So this is a case I worked with for many years, the petroleum sector in Norway, and the project called, it's a 4-year-long project called Digital Worker. And I want to share some examples of how Norwegian research and industry are using digital tools to improve occupational safety and health in petroleum sector, which is quite different. They also have shift work, but they have, let me say, much better both financial and solutions for the workers in that sector compared to the healthcare sector. We led the project using wearable sensors and digital tools to analyze physical workload and ergonomics in demanding industries. And this research helped identify risks and develop practical solutions for safer and healthier work environments. I just spoke to Equinor before going here, and they aimed to implement some of these digital worker technologies, but it took 4 years research to get there. Including real-time monitoring and ergonomic analysis to support safe and productive work in the petroleum sector. One of the studies of the digital work investigated the physical workload, physical demands among maintenance workers and onshore petroleum facilities in Norway. They measured activity, posture, cardiovascular workload, and found that these workers experience a significant physical strain, but there was a high variation between individuals. A key lesson from the ergonomic analysis of digital workers research is that employers need a thorough understanding of workers' physical demands, such as standing, time used for standing, sitting, and movement patterns, before introducing new digital tools. Today, my former employee Sintif is working with cameras for assessing those things. But again, careful research and analysis are essential to ensure that technology truly benefits employees to support safer, healthier work environment. And I know that the next campaign will be on psychosocial work, so I wanted to tell you about this project. It's an ongoing project. The WAGE project is also coordinated by SINTEF, and it aims to help organizations create healthier and more inclusive workplaces. They combine sensor data, service, and age perspective in the research, and the project provides practical guidance for preventing risk and supporting well-being. A key output of this EU project will be the wage index. And my former colleague in SINTEF, he told me that they're aiming for technology readiness level of 7, meaning that it will be demonstrated in a real workplace environment and then be ready for broader implementation afterwards. And the thing about this is they use, of course, AI and different machine learning models to turn complex data into actionable advice for improving both physical and psychosocial health at work. So this is interesting for the next campaign you're running. Yeah, key takeaways. Digital technology can improve health, well-being and productivity in Norwegian workplaces. Success depends on thorough analysis, staff involvement, and also ethical implementation. Technology should support workers, protect privacy, and address real needs, and not just efficiency. Collaboration between research, industry, and social partners is essential for effective solutions. Digitalization is a prerequisite for meeting the challenge posed by an aging population and the demands facing the healthcare sector, and that is a global problem. Thank you for listening, and I'm happy to take your questions.
Thank you for hearing all about this really interesting Norwegian approach. I would like to ask you again if you have any questions from here. It was interesting. I know that you have been visiting the companies, and the importance of staff involvement is so important. And we also, it was nice to hear from you that you was attracted by the idea of ambassadors. Maybe then a question for me, can you, because staff involvement is so important and we spread the message all the time, but in practice, can you give some, maybe 1 or 2 concrete examples, or maybe 1 example, how you've seen the staff involvement working in the companies? Or something that you remember?
Yes, I think that is truly important, and I think all the research projects I have been involved in is always starting with end users, identifying the needs and so on. So I think that is also the way we work in Norway. So I guess that is quite common today. Example, well, I can't, I only have lived from the research projects, but I'm sure maybe, yeah.
Think of some practical examples yeah, so if there are no questions from the room further, then thank you again. And then I would like to give the floor to the next speaker. And like Kyrillos and Hilde, also Stefania has been working on the pre-existing OSH overview since a few years already. She came in the project a few years ago. She is a senior lecturer in European labor law, and she works at the Hague University of Applied Sciences in the Netherlands, and she is a researcher with a special focus on smart sensor systems. So actually that's based on your report, she found us, isn't it?
Yes.
So that's how it works. And she's also a PhD candidate still in the use of wearable technology in the workplace. And she won the NWO Dutch Reward Council grant to carry out this research.
Correct.
That's really good. So I would like to give you the floor now and tell about your perspective from the legal side, especially on the questions that came up on the new AI Act. and how this will be or can be used in practice in the future.
Yeah, thank you, Nick. As she mentioned, I have a legal background, so I will give you a legal perspective on the topic. So in this presentation, I will delve deeper into the development and use of AI-driven OSH systems in light of the AI Act, and I will look into the opportunities and challenges that this new piece of legislation may bring for both the ongoing and the future development and use of such systems. Just a brief agenda. I will first contextualize the topic and then look at how the AI Act classifies risks, systems, and how this AI-driven OSH system fits into the AI's categories. And then I will look at the interplay between the AI Act, GDPR, and EU-OSH regulatory framework, a few takeaways for relevant stakeholders, and I will then conclude. Now, first of all, I mean, a lot has been said already, but there is a lot of research on the use of digital OSH systems, and some of these systems are making use of machine learning algorithms, which can generate content, recommendations, even predictions based on the input that is being received. Examples include wearables, exoskeletons, smart robots, and so on. So these systems present huge opportunities for occupational health and safety, yet they also present risks for fundamental worker rights of workers. You can think about data protection, even the right to human dignity, health and safety at work, of course. So the question is, to what extent or how the AI Act might influence the future development of AI system for occupational health and safety. So this is a piece of legislation which aims at harmonizing rules which relate to the design, the development, and the use of AI systems in the European market. And the idea is to strive a balance between, on the one side, the opportunities and benefits that technological innovation may bring, and on the other side, the respect for health, safety, and fundamental rights. How the AI Act does so is by adopting a so-called risk-based approach. Now, this is something that you've probably seen already, but this is the pyramid of risk. I'm only going to look at the top two layers. So at the top layer, you see those risks that the AI system imposes that are considered as unacceptable. And here, the AI Act prohibits a number of practices, AI systems. One of them that I'm going to have a look are AI motion recognition technologies in the workplace. The second layer from the top are high-risk systems. These are systems that can present and pose harm to safety, health, and fundamental rights of people. And in the occupational context, one example of a high-risk system are those used in occupation, in employment, workers' management, and access to self-employment. And this is also a category that I will look at. Now, starting with prohibited AI practices, the AI Act takes a firm stance against the use and development and design of AI motion recognition technologies in the workplace. As you can see in this slide, Article 5 basically states that AI systems that infer a motion of a natural person in the workplace shall be prohibited, but, and that will be relevant in my presentation, there is an exception if such systems are used for medical or safety reasons. Now, the main question here is, how do we define AI recognition technologies? So the definition that is provided in the AI Act is emotion recognition technologies are those AI systems which have the purpose of identifying, inferring emotion or intention of a natural person based on their biometric data. So what are emotions? There is not a definition given, but the AI Act provides a list, a non-exhaustive list of examples of emotion: happiness, sadness, anger, content, disgust, hope, relief, joy, and so on. What is important is that in order to qualify as emotion recognition technology, this system needs to analyze and process biometric data of workers. And biometric data are those data that can result from the analysis of physical characteristics like fingerprints, physiological characteristics of workers like heartbeats, but also brain waves, and behavioral characteristics. For example, even the way you walk or the keystroke patterns and so on. So if you look in the workplace, there are already a number of technologies that have been developed and some of them also implemented. There are software for facial, both recognition and analysis, also for speech recognition analysis, even wearables like smart earbuds that can be used to, for example, track brainwave activity of workers to detect if their level of attention is still high enough. And this, let's say the application of this technology varies. It can be for example, selecting best candidates, to evaluating employee engagement, monitoring their performance, and as well, and that's relevant for this presentation, as well monitoring and improving workers' safety and health at work. So just to give you two examples of technologies that could qualify as emotion recognitions and that can be used in the workplace for health and safety reasons, and that could be prohibited. One are neurotechnologies. These are technologies that analyze workers' brain data, and one example could be neurotechnologies that are used to track workers' cognitive stress, for example, in office jobs. The second examples are wearables that can monitor physiological parameters of workers that could be used, for example, in the context of workplace wellness programs. These are technologies that, in light now of this prohibition in the AI Act, should not basically be used in the workplace. There are, however, three categories of systems that the AI Act exclude from the scope of the prohibition. The first one are systems that infer emotion but not based on biometric data. So for example, like systems that can infer emotion based on workplace written communication in emails or Teams messages. There are also excluded from the scope of the prohibition are AI systems that infer physical states of workers, for example, fatigue. So this could actually open the door for AI system for fatigue detection, for example, neurotechnology. There are also AI-powered cameras and also smart wearable textile for fatigue detection. And the last categories are AI systems that are only detecting what they're called readily apparent expression, gesture, or movement, which basically means they're only, let's say, counting how many times a worker is smiling without concluding that if the worker is actually happy or not happy in the workplace. So these are not considered as AI emotion recognition technologies, hence they are not prohibited under this specific provision. As I said before, there are also certain AI emotion recognition technology that are defined as such. They infer emotion from workers, but they are exempted from the prohibition. This is an exception. So what Article 5(1)(f) states is that if there are medical or safety reasons, such as systems, even though they infer emotion of an individual, they could be allowed in the workplace. Now, how do we interpret this? The Commission has published some guidelines in February 2025, providing some interpretation on how this provision should be interpreted. So first, this is a case-by-case assessment, and secondly, this exception needs to be interpreted narrowly. What does it mean? And here I kind of link with the previous presentation. Several factors must be taken into account to decide if this exception is applicable. For example, is emotion recognition something that is necessary to prevent occupational health and safety risk? Is it proportionate? Are there less invasive means to reach the same goal? Are there adequate safeguards put in place, for example, in terms of how much the timing of the monitoring or how much data you actually collect, who has access to the data? So these are all factors to be taken into consideration. So based on this and based also on the Commission guidelines, the exception is not going to be applicable, for example, for AI systems that aim at monitoring general level of stress and detection of a general aspect of well-being and mental health of workers, like burnouts. So here you can think about, for example, wearables that measure worker stress in office settings. Having said that, this exception could actually be used in relation to AI systems that monitor stress level, concentration level in safety critical profession, for example, in transportation, construction, first responders, as the Commission, for example, give as an example monitoring stress for workers who operate dangerous machineries or who use dangerous chemicals. Now, this is the category of emotion recognition technology, which I mentioned is something that is being prohibited with an exception in the Act. The second category, so the second layer in the pyramid, relates to what they're called high-risk systems. So when it comes to high-risk system, the EI Act identifies two main categories. So the first categories are, and I know here it gets complicated, are EI systems that are safety component of a product. You can think about a personal protective equipment or even a toy, a machinery, a vehicle, or that are the products themselves. So these are EI systems that perform a safety function for a specific product. So these systems are classified as high risk if two conditions are met. One, the product, let's say the personal protective equipment, the cap, the hat, the safety helmet, is regulated in one of the product safety legislation listed in the EI Act, and the EI Act lists the PPE regulations as well as the machinery directive, now abrogated by the machinery regulation. And the second condition that needs to be met is that the product needs to undergo a third-party conformity assessment. Now, if we look at EI driven OSH system, we could include in this category of high-risk systems smart personal protective equipment and smart machineries, of course, provided that these two conditions are met. Moving to the second category of high-risk systems in the EI Act, these are the so-called standalone systems. So what the legislator has done, has listed in a list 8 use cases, applications of EI systems that are considered high risks, and hence there are mandatory requirements and several obligations for both providers and employers, hence employers of, that are making use. So there are two categories that I would like to show you. So the first one are EI motion recognition technologies, which basically means if the technology is not prohibited, is still in the category of high-risk systems. So this could apply, for example, for those EI systems that can be used for medical and safety reasons in the workplace. They are not prohibited, but they could still be considered as high risk. I'm running out of time, right? Okay.
2 minutes.
Okay, that's fine. Then I'll. The second category are those EI systems that are used in employment, workers' management, and access to self-employment. These are the traditional, let's say, EI system used in what is called algorithmic management. And these are systems that are intended to be used, for example, for selection of personnel, but also to make decisions that affect terms and work-related relationship like promotions or and contractor relationships, as well to allocate tasks, monitoring performance, and so on of workers. Now the main question here is, what about EI-driven OSH systems? Do they actually fall in the category of high-risk systems, and specifically in the category of employment, workers' management, as access to self-employment? And I'm posing this question because if we go back, in the second part of this slide, you see there is no specific reference in the EI Act to EI systems whose purpose is OSH related. So this may actually lead to conclude that these systems actually are not classified as high-risk systems. When it comes to the interplay between the EI Act, the GDPR, and EU-OSHA legislation, what is very important to keep in mind is that the EI Act is a complementary legislation to whatever is already existing in national legislation and European legislation. What this means is that even if a system is not prohibited or is classified as high risk, that doesn't mean that it's allowed to use it in the workplace, because GDPR and OSH legislation is still applicable. When it comes to the EU-OSH framework, for example, like when these systems are being put in place, there should not be any shift in OSH responsibility, which means that the employer remains in charge and remains responsible for workplace health and safety, and also remains in charge of conducting the risk assessment when these systems are put in place, even though these systems have let's say, a benign purpose of protecting workers' health and safety. And finally, also when it comes to GDPR, as already previously mentioned, all the general principle of an employer needing to have a legal basis to introduce such a system needs to of course, to be respected. And I'm almost done. Just a few takeaways for relevant stakeholders. When it comes to, let's say, scientific research, given the novelty of the topic, there is still need for further research, especially when it comes to the application of the AI Act to high-risk systems and on the interplay between the different regulatory frameworks. When it comes to at the level of EU policy, further clarity is needed, for example, when it comes to the distinction between terms like emotion and physical fatigue, which are often blurred, and the application of AI risk system, of the category of AI high-risk category to AI-driven OSH systems. The Commission has launched consultations recently, and they will adopt some guidelines on high-risk systems by 2 February 2026. And finally, when it comes to employer, workers representing OSH personnel, there are still quite a lot of gray areas, ambiguities, and also layers of regulation which basically raise compliance risk for employers. And at the level of worker representative, OSH professional, there's still quite a lot of questions as to, for example, the practical implementation of information and consultation rights and how these systems basically can be integrated into the existing company's OSH management system. So to conclude, for conclusion, what the research has shown is that the AI Act will restrict the entry into the market and the use of a number of AI emotion recognition technology, even some technology that could be used for OSH purposes. There are a number still of ambiguities, unclarity, uncertainties, and lack of clear boundaries between categories, emotion and physical states. This may put a brake on the further development in this field, as you can already think providers, so the technology developers and employer may be more cautious as they face compliance risks. Having said that, the exception for medical and safety reasons and the exclusion of physical state from the definition of emotion recognition may actually open doors for the further developments of certain innovative AI OSH systems. One example could be neurotechnology for fatigue detection. And finally, well, the last conclusion, when it comes to this specific area, AI-driven OSH systems are regulated by multiple legal instruments, and this will require careful consideration, especially in the design phase, developing, and of course, implementation phase. As yesterday was mentioned by the member of the European Parliament, the Parliament in June of this year has issued a report with a draft of a directive on algorithmic management. So it remains to be seen also how this new, hopefully, let's see, new directive on algorithmic management will actually have an impact on this system, as one of the articles says that emotion recognition and neurosurveillance technology should actually be prohibited in the workplace. So let's see. Thank you so much for the time.
Okay, well, we asked you some time ago to do this research in a kind of an approachable way, so that also non-legal people would understand it. And this is the most of it, that it's still true, but it's still as non-legal as possible. So thank you for that. I think maybe. The presentation is also available for who wants to read it again. I have quite time for 1 or 2 questions, and then we go to you, and then at the end there could be more time for questions. So, yeah, okay. I see.
As a disclaimer, I may answer as it depends, because I have a legal background, but so.
Okay, that's maybe a little bit theoretical question regarding the usage of the existing devices and the emotional impact. When I'm thinking in a broader way, and I can imagine that the employer is giving to the employee the mobile phone for the communication, what we should do as an employer, we just need to take the mobiles out of the employee hands, because every mobile, from the historical point of view, is able to recognize the emotion of the employee by touching of the screen, by moving on the screen, and so on. And we have no clue where the data are coming. And we have a lot of similar devices which we actually use in our, let's say, working activities. Thank you.
And may I ask you if the specific question, like, would you like me to elaborate on?
Overall recommendation from the committee or from the AI Act, how as an employer to act in this case? Or how to recognize exactly the device which is in the high category?
Well, the AI Act is a product safety legislation, so in a way it doesn't go in details as to how the employer should act in these cases. So, for example, when it comes to the use of, let's say, mobile devices, or even, there are a number of softwares that are probably already pre-installed in your computer that tells you, like, how productive you have been or how much communication you had with your colleagues. When it comes to those type of devices or softwares, that's like, you need to resort back to the application of the General Data Protection Regulation. The AI Act doesn't offer any guidance on whether employers should or should not use them, or how employers should use them if allowed. Yeah.
Yes, thank you. Thank you very much for really interesting presentation. I'm representing the Association of OSH professional people working in Europe, and there are just a point that is, in Europe we have different legislation. For example, in Italy we have a law that obliges the employers to use the best technology available in this moment if an accident happens. And of course, this is a problem of fighting between two different laws. One say you cannot use it, another one say you have to use it. And this is a very big problem. And another topic that we asked, and we did as ENSPO some presentation to the Omnibus Act just related to this topic, because it's not only a problem of recognition, of emotion and so on, it's a problem even of cost. Because if you are using or developing some applications that is in the high risk, you have so big cost of documentation, of activity, that is really fighting against the willing to use the technology to go towards the reduction of accident, and not to go in the control of employees and so on. So this is a very big problem, because in our opinion we sometimes have some confusion between safety and security, and if we are working on safety, we need to save people's lives, and we have to decide what comes first. The right to for different rights, or the right for life?
Yeah, it's a really interesting question. I'm actually looking as well at the interplay between, as you said, like the obligation that employers have to do their best or their utmost best to protect their health, exactly whatever, as you say, the maximum available technology. I'm Italian by origin, so, and how that actually may clash with other legislative frameworks, like if you collect a lot of data from workers to keep them safe. So you are kind of, as an employer, complying with OSH legislation, but at the same time you're collecting a lot of data, also, let's say, related to physiological problems. So how do you actually balance the two? And these are very interesting questions, especially when it comes to, like, how do you balance the two in practical scenarios? Yeah, thank you.
Thank you. I promised Hilde for the exceptional first question.
Thank you so much. This is so important work, and luckily we have an AI Act in Europe. They don't have that in the US because they want to speed up innovations. So I'm so happy that we have it. But there is one thing about this, both the wearables and also the tools for monitoring, like face recognition for monitoring moods and emotions. This is highly difficult, and you didn't mention that, but do you think that there is a health equity risk? For example, discrimination of vulnerable people? I mean, everybody has ups and downs, you know, but some maybe have more downs, and it shouldn't discriminate them from work. Do you have some perspectives on that from an ethical perspective?
Well, it's a really good question because, for example, when it comes to neurosurveillance, so monitoring brain waves of workers, there is research that says that the outcome of the monitoring can actually lead to different results depending on, for example, like issues related to, questions related to neurodiversity of people. So it could also lead, for example, to discrimination against, for example, people with some neurodiversity. Yeah, it's a good point. Yeah, so that's definitely something that also from an ethical perspective to take into consideration. Yeah.
Thank you very much. And maybe in the end there could be time for some questions.
Thank you.
Thank you, and very interesting indeed. So now I would like to give the floor to Elsbeth de Korte. She's a senior project manager and research scientist at TNO's Work, Health and Technology Department. She worked there since 2000, so actually we worked there together for a while. And she coordinates TNO's Mental Health of Workers research program. And the key area of her expertise is investigating how emerging technologies can support healthy and safe working practices. And also she's a member of the OSH, ALMA AI project team, and I think from that perspective on you're here today, and yeah, please start. There's enough time between 15 minutes max.
Okay. Thank you, Aniek, for inviting me and for your kind introduction. Welcome. Today I'll present key insights from the Paris ALMA AI project. This is a European research initiative examining how algorithmic management, ALMA, and artificial intelligence, AI, are impacting occupational safety and health, OSH, in regular workplaces across Europe. And this work is the result of a collaboration between 8 Paris institutes. Here is our agenda. I'll start with a brief introduction to the ALMA AI's project scope and results. Then I'll walk you through the findings and what they mean for job demands, job resources, and occupational safety and health. And we'll also discuss factors that can moderate these effects. And I will finish with some practical recommendations. The Paris ALMA AI project brings together over 16 researchers from 8 Paris institutes across Europe. And it was under the guidance from EU-OSHA and the Joint Research Center. Some of the researchers are also present at this summit and even in this room. Maybe you can raise your hand. And PAROSH is the Partnership for European Research in Occupational Safety and Health. Algorithmic management is increasingly common, and not just in platforms, but also in regular workplaces. In this project, we were particularly interested in the risk and the opportunities this brings for occupational safety and health, especially the psychosocial factors like stress, autonomy, and social support. The use of algorithmic management is expanding rapidly, and this is driven by digitalization and AI. And while algorithmic management started in platform work, it is now spreading in traditional sectors like logistics, manufacturing, offices, and public services. And this shift has profound implications for how work is experienced, managed, and also regulated. The graphic on the left shows the rising scientific relevance of algorithmic management. When we used at least one of the terms algorithmic management or artificial intelligence, we reached over 41,000 peer-reviewed articles. But besides the scientific interest and its societal relevance, there's an important practical issue for boosting the ALMA AI project in Paris, which is the forthcoming regulation in Europe. One crucial legislative initiative is the EU Artificial Intelligence Act, or AI Act, as explained by our former speaker, Stefania. And this means that enterprises that use AI systems for algorithmic management will need guidelines to evaluate the occupational safety and health risks and also plan preventive actions in the near future. However, the first step to developing any practical tools is to know what their main risks and hazards are. And it would also be appropriate to consider the potential positive effects. Our approach consisted of a comprehensive literature review. We screened over 600 publications from 2022 to 2024, and we selected 39 key studies. The selection criteria we applied were that the topic had to be about algorithmic management, focused on occupational safety and health, and with direct evidence. We selected 33 peer-reviewed articles published in scientific journals and 6 reports of recognized institutions, such as the EU-OSHA, the Joint Research Center, and the ILO for the grey literature. And these covered a range of sectors: logistics, hospitality, office work, IT, and more. There are many different definitions of algorithmic management to be found in the literature. Generally, algorithmic management is defined as the use of complex digital systems or AI to manage workers. But in our project, algorithmic management, or ALMA, is defined as the use of computer-programmed digital systems to semi-automatically perform management functions that traditionally had been performed by managers or supervisors. Our research report consists of several very interesting chapters, but today I will focus on chapter 4.1.2, and this was on the statistical evidence on algorithmic management in regular work around Europe. For this chapter, 7 of the 33 selected articles were used, and 2 of the 6 grey literature reports. The focus was on regular workplaces, such as the transport and logistics sector, hospitality, and office workers, for instance, customer service and finance. Although much research focuses on control and efficiency, algorithmic management should be seen as a broad new form of work organization, not just surveillance, but also task allocation and performance evaluation. And as a result, most occupational safety and health risks linked to algorithmic management are psychosocial. And this is arising from how work is designed, organized, and how social relationships are managed in the workplace. For the analysis, the ALMA AI project used an adapted model to focus both on the positive and negative outcomes relevant to occupational safety and health, and excluding issues not directly related to occupational safety and health, such as performance. It is primarily based on the job demands resources model, but also incorporates key concepts from the demand control support model and the effort reward imbalance model to highlight well-established psychosocial factors that can create occupational safety risks or opportunities. Based on this adapted model, I will discuss the key findings on job demands and psychosocial pressures, job resources and potential benefits, and the key outcomes for OSH. One of the clearest findings is that across Europe, algorithmic management tends to intensify job demands, and employees report more time pressure and stress, especially when digital monitoring is used to track performance or allocate tasks. The findings show that algorithmic management poses greater psychosocial risks for clerical and skilled workers, who are more exposed to automation and detailed monitoring than professionals and administrators. Notably, remote work helps to reduce these risks by offering more autonomy and flexibility. But overall, algorithmic management still increases the likelihood of excessive job demands, lack of resources, and psychosocial issues such as stress and poor communication in European workplaces. While algorithmic management could theoretically free up resources or provide fairer evaluations, the evidence shows it often does the opposite, reducing autonomy, trust, and opportunities for meaningful collaboration. While these are key ingredients for innovation and well-being, the effects are not uniform, and sector context matters. For example, logistic workers report less motivation to help colleagues, IT professionals feel less creative, and hospitality workers experience more discrimination and turnover. So these sectoral nuances are important for tailoring interventions. From the data, it can be seen more intense use of algorithmic management is linked to a 16.5% increase in occupational safety and health problems. This includes not just stress, anxiety, and burnout, but also physical symptoms like headaches, fatigues, and joint and muscle pains. This relationship is statistically significant and robust across multiple studies. And this is a call to action for all stakeholders: scientists, employers, unions, and policymakers. But there are ways to mitigate these risks. Employee participation, giving the workers a voice in how algorithmic management is implemented, and transparency about how these systems work can buffer negative effects. Transparent systems are linked to a higher perceived fairness and lower turnover. And social dialogue, participatory approaches, and clear regulation are key levers for positive change. To wrap up, algorithmic management is rapidly changing the landscape of work, and while it brings efficiency, it also raises significant risks for worker health and well-being. By focusing on participation, transparency, and continuous assessment, we can harness the benefits while minimizing the harm. And these steps not only protect health and well-being, but also will foster trust and engagement. So, for employers, involve your workforce early. For unions, push for transparency and participation. And for policymakers, support evidence-based regulation and social dialogue. And for scientists, keep developing robust tools and share the findings. And together we can ensure that algorithmic management supports both innovation and worker health and well-being. Thank you for your attention, and I will be happy to take any questions.
Thank you, Elspeth. Nice how everything falls together, and this beautiful parish research, evidence-based, provided these results based on the job demand model as well. Do we have questions from the audience to the max? Or you were very clear already? Do we maybe have an online? Yeah? Can you?
Yes, so we have a question from our online audience. And the question is, as we have heard during these days on several occasions, digitalization increases both opportunities and risks. And then the question that is perhaps relevant to all panel members, in your experience, which new occupational safety and health risks are currently underestimated by employers when introducing AI or digital tools? So which are the risks that are most underestimated by employers, and perhaps especially in small and medium-sized enterprises who might not have the expertise to, keep up with all the AI legislation and so on? Thank you.
So thank you for this question. Well, I think if we look at the scientific literature, that the risks that are very important to look at are psychosocial risks, and especially because algorithmic management changes how the work is organized. I think one of the most important factors to look at is the job autonomy for workers. But there are also many other risks to look at. And today I focused on the psychosocial risks, but in the report also other risks for occupational safety and health are discussed. The report can be found online on the parish website.
We can ask, my colleague Sabi, we can ask the same questions. Maybe somebody here would like to answer? And the question was, what risks are underestimated? By employers, specifically.
Yes, so to repeat our question from the online audience, which are the risks currently most underestimated by employers when introducing the AI and digital tools, and perhaps especially with a focus on small and medium-sized enterprises who might not be that up to date or just simply don't have the resources to follow all the new developments? Thank you.
Yeah, I don't have, I think, much to add to what Elspeth has said, but all I can say is that the question is, it's difficult to provide a clear-cut answer to this question because those risks can vary across sectors, but also within the same type of organizations, you can find very different risks that are not accounted for. But I would tend to think that also in our research, we found that psychosocial risks are the ones more underrepresented, but also difficult to define because it's really hard to measure the net effect of how the introduction of one technology might affect psychosocial health. So it's not really an answer, just to corroborate what Elspeth has said. I think there's room to explore more the effects on the psychosocial domain. So yes.
Yeah, I would like to comment. First, thank you for a really thorough study. I love to see all the literature you've been going through, so it's really evidence. But yeah, to your question, I think that there are some ethical risks by moving too fast using these digital tools. We have examples. If you use this tool as human resources management, you can use, for example, wearables to look at or identify early signs of disease. But how do you manage that? It can, in the worst case, also turn into risk factors to be fired. you can lose your job, and you have examples of that. Another example is the monitoring and surveillance that some of you have heard about, that taxi company implemented it to monitor drivers' fatigue and speed for safety reasons, which is a very good thing, of course, but it was also used then to dismiss some drivers. This was Uber. It has been in the newspaper, so I can tell. So I think this part of it, you need to be very, very clear about how you will use these AI tools, and especially when it comes into monitoring moods and feelings and these things. And we also know that what is happening on the wearable sides, the algorithms used, is not, it is still not enough studies on, for example, female subjects compared to men, because all the time I worked as a physiology, all the studies were done on young, healthy men. And we know that the algorithms of moving wearables forward is not, it's not there yet. It's going there, it's very good, but it's not there yet. So these risks is maybe difficult for a small company to know about if you haven't digged into it as a researcher, or, so yeah, thank you.
Do you have any idea outside of the OSH world?
No, well, I can only reiterate, I think, what you mentioned. Sometimes the lines between monitoring for OSH and monitoring for performance or productivity are rather blurred, and that may also lead to the emergence of psychosocial risk factors. So that's something that, I think, the smaller the organization is, probably the less maybe aware the organization is. So that's something to take into account. Thanks.
Thank you. Thank you. Back to you.
Yes, thank you. No, very clear, but maybe I can add something about small and medium enterprises. And I don't have much information how the risks will differ for these companies, already said by Kyrillos. But I think it is very important for us being here that we also think about how we can reach these companies. There's still a task for us, I think.
Yes. Another question?
Yes, thank you. I think there are, as said, many ethical risks, but especially for smaller employers, I think there are serious legal risks, and perhaps it's a question to the former speaker. I remember when we introduced track and trace, for instance, but with the possibilities there are now, I suppose there are going to be many legal cases against us on the level of GDPR.
Yeah, I think that's absolutely the main issue, and I think like what you could look at is how to, for example, like minimize the amount of data that is being collected, or working on, for example, the level of aggregation, or saving of the data. Right, saving, storing, and who has access to the data. Is just the worker or the line manager, or these are all interesting questions that may tilt the balance between what is actually allowed and not. I don't know if you have seen, like last year, the French Data Protection Authority issued a fine of 32 million euro to Amazon France Logistique, because they were not in compliance with a few provisions on the GDPR in the use of their scanner. These are these are relevant questions, and they may also slow down definitely the development of certain systems, even for OSH. Yeah.
Thank you. So yes, it's time. So first, I'd like to thank you again for the really interesting work, and last, I mean, this is not over. I mean, you made. It was already there. You made really the step very clear to the new campaign, which is on mental health. And also the role of SMEs will be really have an important role in this new mental health campaign on the connectiveness on psychosocial risk. So yeah, let's go on. Thank you again, and yeah, the applause for you.